Last year, about 1 in 17 babies in Maine were born exposed to or affected by opioids. Traditionally, medication is used to treat the newborns.
But a new study shows that might not be the only viable option. Joy Hollowell introduces us to the Eat, Sleep, Console approach.
So what we found in the study was that babies were far less likely to receive medication, about 60% less likely. And as a result, they were able to go home more quickly, about a week earlier.
When a mother uses substances during pregnancy, her baby may become addicted and begin withdrawal upon birth. It's a condition called neonatal abstinence syndrome. Eat, Sleep, Console encourages involvement from parents and prioritizes care that doesn't involve medication. Approaches like quiet, low-light environments with swaddling, skin-to-skin contact, and breastfeeding when possible.
When using the ESC care approach, we actually increase parental presence. And so families feel empowered to be there and to be part of their baby's care. And when value is placed on your role, you want to be there.
The study followed these babies for up to 3 months after their release from the hospital.
And there was no evidence that the newer approach, the Eat, Sleep, and Console approach, had any negative effects.
The researchers say it's important to note that this approach does not completely replace the use of medications.
Some babies have withdrawal that can be quite severe, and in those cases, medication is a completely appropriate next step as part of their care.
The ESC care approach was actually developed about 8 years ago, but until now it hadn't been tested in such a large population.
So the hope is that, for example, the American Academy of Pediatrics will use this study in terms of updating their recommendations for treatment.
Joy Hollowell, WABI TV5 News.
Eat, Sleep, Console was implemented across the Maine health system in 2018 and 2019.